Ladies and gentlemen, we will begin in a couple of minutes from now. In the interim, may I request you to kindly share the link with your family and friends all across the world. This talk show will help different age groups, particularly as you grow older. Similarly, it will help people across countries, since hearing is a universal subject without any boundaries of sex, nationality, or religion. Share the link. Let your friends and family members benefit from this very educative session. We have a great speaker this morning, and let's all take advantage of his wealth of knowledge on the subject. A few seconds, ladies and gentlemen, and we will be ready to go.
Sheila.
Good morning, ladies and gentlemen, and welcome to the fourth Virtual Knowledge Worth Having series organized by the Catholic Gymkhana Limited. Ladies and gentlemen, this morning we come to you live using two platforms of communication, Zoom and our very own dedicated Catholic Gymkhana YouTube channel. Manning our control room this morning are two very efficient technical committee resources who I enjoy working with, Aubrey Chatelier and Managing Committee member Ian Pereira. With Aubrey and Ian in charge of the technical aspects, we have all bases covered. However, since technology can sometimes be unpredictable, I must forewarn you and advise you, ladies and gentlemen, that if at any time we lose internet connectivity with the speaker or with me as the host, please continue to hold on. Do not switch off. The speaker losing connectivity will come back. Our control rooms at Aubrey's and Ian's residence will work behind the scene to assist restoring connectivity as soon as practically possible. So what exactly do we have lined up over the next 100 minutes? We will start off, ladies and gentlemen, with the President's introduction of the speaker. This will be followed by a discussion with our speaker. Thereafter, we will take question and answers from the audience. Those will be addressed by our speaker. And finally, we will end with a vote of thanks. Ladies and gentlemen, this is your last opportunity to invite your friends and families from across the world. Let me remind you that those of you interested in asking questions, please post your questions on the YouTube chat. These will be collated by our control room manned by Aubrey and Ian and transmitted across to me as the host and the compere, and will of course be answered by our speaker, Dr. Christopher, at the very end. Ladies and gentlemen, let's get the ball rolling on what promises to be a very informative and useful session. I now call upon our very hardworking president, a president who takes care to ensure that every minute detail of the operations at Catholic Gym are well taken care of. Without too much ado, ladies and gentlemen, my privilege to call upon our president, Mr. Vernon Miranda, to introduce our speaker this morning. Over to you, Vernon.
Thank you, Sanju, for those kind words, which are beyond my desert. Our honorable speaker, Dr. Christopher De Souza, dear members, guests, ladies and gentlemen, hello everyone, and welcome to today's session of the Knowledge Worth Having seminar presented by the Catholic Gymkhana Limited, an initiative of the Managing Committee. I take this opportunity to wish you all a happy feast of the Assumption of Our Lady and a happy Independence Day. Warm greetings to you on behalf of my managing committee colleagues. I have the pleasant responsibility of introducing a person who needs no introduction. Our speaker today, Dr. Christopher De Souza, is a prominent person in the field of ENT surgeons of Mumbai, India, and beyond. Christopher is gifted with a gentle approach with patients, and he makes them feel at ease. Almost immediately during his process of consultation. I say this from my personal experience. Dr. Christopher De Souza did his MBBS from St. GS Medical College and KEM Hospital. He did his postgraduate training at the Department of Otolaryngology, Head and Neck Surgery, GS Medical College. He has a string of diplomas, degrees, and fellowships from renowned institutions, both from India and abroad. A fellow of the American College of Surgeons and fellow of the Royal College of Surgeons, London. Christopher is on the faculty of the State University of New York for the last 26 years, and also at LSU, Louisiana. Christopher is the only ENT surgeon living in India who has authored 7 postgraduate medical textbooks in the USA. This, ladies and gentlemen, is a huge achievement since the American Medical Association only allows quality approved medical textbooks in the US. He has edited and authored 38 postgraduate medical textbooks. Christopher has several awards for academic excellence, with the Manubai Mehta Gold Medal for standing first in the Diploma in Otorhinology, College of Surgeons and Physicians, Mumbai. First in Master of Surgery in Otorhinology at the St. GS Medical College. A prominent international award to the credit of Christopher is the Hamilton Bayley Scholarship and the prestigious Orbit International Silver Medal, being the first Indian to be awarded this prestigious award in the field of nasal and paranasal sinus and orbital surgery. Dr. Christopher has presented several papers at national and international conferences. Presently, Dr. Christopher is otolaryngologist and head and neck surgeon at the Tata Memorial Hospital, Leelavati Hospital, and Holy Family Hospital, where he specializes in treating multiple ENT problems. Christopher also excels in non-medical skills, being a concert guitarist and a prolific writer. Christopher has a charming and always smiling lady in his life, Dr. Rosemary, who is the head of intensive care department at Nair Hospital. Rosemary has many admirers and well-wishers for the humanitarian services she renders to one and all. God has blessed this doctor couple abundantly. One of their daughters is a Rhodes Scholar. One can easily count on our fingertips the few Rhodes Scholars in our community. A matter of great pride and satisfaction. I am thankful to Dr. Christopher for accepting my invitation to address our members today. It is a great pleasure for me to present to you our much celebrated speaker, Dr. Christopher De Souza. I am confident of being an enlightened individual on ENT issues after this interactive talk session. Thank you, ladies and gentlemen, and over to you, Dr. Christopher and Sanju. Thank you.
Thank you very much, Vernon. Thank you for that very impressive introduction. And it's now time for us to go over to our respected speaker, Dr. Christopher De Souza. Firstly, Doctor, thank you so much for agreeing to talk to our members and guests despite your very busy schedule. Let me straight away start off, Dr. Christopher, a very basic question. What exactly causes deafness?
Good morning, ladies and gentlemen. I'd like to thank the president and the committee members of the Catholic Gymkhana for inviting me here to share my experience and the knowledge that I have accumulated over 35 years. And I'd like to wish all of you, like Vernon said, a happy Independence Day and also happy feast. The consequences of diminished hearing are profound and can deeply affect personal relationships and for the worse. So it's very important to understand that hearing is a very important aspect of the five senses. And later on down the talk, I will show you that of all the five senses, we ENT surgeons are one of the few who are able to restore it in spite of somebody being profoundly deaf. Now, the consequences of hearing are this: it's like a cascade of events. If a person who is deaf answers inappropriately to a question, then that person will be avoided socially. Once avoided socially, that person becomes isolated. Isolation frequently leads to depression. Depression over a period of time leads to diminished cognition. Cognition means understanding the context in which you are in and responding appropriately, not only to sound, but also to the situation around you. And that in turn leads to Alzheimer's disease. So you can see this has all been proven scientifically. So you can understand, therefore, the very profound effects of hearing.
Thank you, Doctor. The consequences look to be a lot more severe than one would have imagined. But before I can get on deeper right into the heart of this discussion, Dr. Christopher, if you could spare a few moments in explaining to us what causes deafness. Is it hereditary? Is it because of any other reason? What really is the cause of deafness?
The causes of deafness are many. The common cause is, of course, hereditary. And usually when patients are questioned, they will say, yes, well, my father went deaf, as he grew older, my mother grew deaf. So there you have a direct cause, and you can understand that this person has got an inherited hearing problem. But what we are seeing now is not only that, but many factors acting together. For example, the person will be exposed to noise, especially in a noisy city like ours. People who are frequently exposed to noise, this leads to cumulative trauma. Cumulative means small amounts of trauma adding up to where it goes past the tipping point, and then the hearing goes for a toss. Furthermore, such problems are progressive. That means that if a person has a hearing problem caused by noise, it will gradually worsen as time goes by. Then there are other factors like what are the causes of problem? For example, wax inside the ears. Then the person can have fungus in the ear. The person can have perforation of the eardrum. So these are, I'd just like to share you a few pictures of this problem where I'll show you what wax looks like, and you'll get to understand that this is how this is a picture of wax inside the ear. Let's put this on. As you can see, this is wax. Now, when wax is inside the ear, it prevents the conduction of sound. And a simple thing like this, when it is removed, it restores hearing considerably. So this is one thing that I'd like people to be aware of. Don't just dismiss the person saying, well, your mother and father went deaf, so you are deaf now. But removal of this wax can improve hearing considerably. The other things that people need to know is that you can get fungus. Now, people are putting objects inside their ear. This can lead to fungus. Fungus will gradually destroy the eardrum and cause a hole in the eardrum. So this is treated to a very simple measure. As I will explain down the line, that certainly do not instrument your ears. The other is that a person may have a hole in the eardrum. So this hole in the eardrum leads to hearing problems which can be treated. So I just like to, go back, and those are the two pictures that I wanted to share with you.
Sure. Doctor, a lot of these seniors, a lot of our senior citizens would often have relatives or caretakers or caregivers with them. All of these caregivers, all right, would want to know how exactly would you identify that a senior is beginning to have a hearing problem? Are there some kind of signs? Is there a medical sign or any other sign that the caregiver would get at the very initial stages to give them the clue that something is going wrong?
Yes, first of all, it begins off in a very subtle way. Now, the person asks for the question to be repeated. He said, what did you say? I say, eh? Repeat that. So then you know, okay, well, this person's got a hearing problem. But if the person mishears, that is to say, the person says, if you ask him, how are you today? He says, well, the geyser was on or something like that. Then you know that the person has misheard and has answered inappropriately. If this happens very frequently, then you know that this person got a likely hearing problem in the making. How severe or how mild it is, that will remain to be assessed. Then, if the person is unable to hear common day-to-day sounds, like the doorbell, like the telephone, then you know, yes, this is certainly a problem. But the most common thing which I face, which I see, and I'm sure all of you are aware of, is when the TV or the radio is really loud, and even the neighbors can hear what program you're listening to. And even then, the senior may say, I didn't understand what was said. And only when there are subtitles, he can understand. That means even though the volume of the TV set is loud, the person is still not able to understand everything that is being spoken. So this I would say is a very clear sign that the person needs, that there's a hearing problem in evolution and needs to be assessed. And it's a common thing which doesn't require much scientific knowledge, but a thing which anybody can understand.
Sure. Doctor, we know a lot about wax being formed in the ear. All right, this is quite a common problem. But does the presence of wax actually cause a hearing problem? How is wax related to hearing as a problem?
Yes, wax, first of all, is listen to my words carefully. because people consider it dirt. It's not dirt. It's a normal, it's a natural and essential secretion in the ear. It is found only in the ear. It's not found in any other part of the body. Now, this wax has to form a thin film around the ear canal. Why? This is so as to, one, waterproof your ears. Number two, it acts as a chemical substance which prevents germs and fungus from growing inside your ear. Remember that your ear canal is dark and it's cold and at times moist. Ideal factors for germs and other organisms to grow inside your ear. Because of the wax, this does not happen. So wax is a normal, necessary, and essential secretion found only in the ear. Now, when wax is first formed, it's a thin, pale yellow substance. And as it is extruded by the ear, it gradually gets oxidized and becomes black. But please remember that this is, this is not dirt. This is a natural secretion meant to protect you. The wax gets extruded from your ears, and that's how in the morning, if you wake up, you might find your pillow a little gray. That is because the wax has been extruded. Once in a while, the wax collects, and then therefore it needs to be removed. Now, who should remove wax? Only an ENT surgeon. Why? Because to see clearly, the ear canal is very small, is very delicate, and it is tortuous. So we have to see very clearly, have the right amount of instruments, and then gradually remove the wax. It's only, there are different methods to remove the wax. That's a different thing altogether. But so like I said, this is how wax should be treated, and that's how sometimes it causes a hearing problem.
Well, doctor, when it comes to tests, are there specific tests that are available to determine the hearing levels of individuals? Is there some kind of a numerical algorithm that is there, or some kind of a score or a scorecard that one would give, to say 2 out of 10 is bad and 8 out of 10 is good? What are the kind of tests that actually exist to conduct or determine the exact hearing level of any individual?
This is something which is very important for people to remember. This is a very pertinent question and very, very relevant. There are 3 tests. Now, I trained at the University of Minnesota and then at Baptist Hospital. And all over the US, I saw these 3 battery of tests that need to be done. Unfortunately, in our city, I don't know why, only 1 test is done, but there are 3 tests that need to be done. The first is what we call a pure tone audiogram. The pure tone audiogram, first of all, the hearing test has to be done in a clinic, and the clinic should be sound treated. That means when the test is being done, the person should not hear sounds from around him, because then that will interfere with the test. The second thing is that there are 3 tests, 2 of which are subjective and 1 is objective. When I say subjective, I mean that the test depends on the person who is performing the test, the condition of the equipment, and is the person or the patient being examined paying careful attention. So these tests have to be done in a sound treated clinic with the right equipment. The first test is what we call a pure tone audiogram. That means we ask the person to raise their hands and tell you that, well, at this frequency, this volume, I can hear this sound. So these tests are conducted at different frequencies at 500 hertz, 1000, 2000, 4000, 8000 hertz. So the least volume of sound, the least intensity of sound will tell you, okay, this person can hear the sound at this level. This tests whether you can hear the sound or not. The second test is very, 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 I cannot stop the number of varies, but very important. Regrettably, And not many people do this test, but it should be done. And I'd like anybody who, after this talk and visiting your ENT surgeon, should insist on these three tests. The second test that I'm talking about is what we call speech reception threshold and speech discrimination score. See, it's while you may hear a sound, you should be able to make sense of it. So the speech reception threshold will tell you at what intensity of sound you are able to identify the word correctly. So you're given a word which is called a spondy, and it's like cat, dog, and things like that. Can you hear these words correctly, and at what volume? So once you identify the volume or the loudness or the intensity at which this sound can be heard, then that's the threshold at which the person begins to identify the word correctly. The second half of that is called a speech discrimination score. That is to say, we give the person a phonetically balanced word like baseball, ketchup. If the person is able to identify those words correctly at the speech reception threshold, then we give them a score. 100% is fantastic. But as it drops, that's when the problems start. So we use all over the world, especially at the University of Minnesota and at Baptist Hospital where I worked, 75% was the threshold where you say, now the person has a problem discerning words. Now, what are the problems that occur when the speech reception threshold drops and the speech discrimination score drops? If the speech discrimination score drops below 75%, then the person starts to make mistakes. The mistakes are between words with have P or B. If I say pat, the person here will hear bat, and so miss here. They'll miss the sibilant sounds, the S sounds. If I say ship, they will hear hip. They'll also make a mistake between M and N. So if I say money, they'll say it's nunny. And the last thing is when they go into a crowded room, they will get totally lost. So then this leads to confusion, especially if they go to a party, the noise is blasting, people are all talking at the same time. They will not be able to hear accurately. So the speech reception threshold, speech discrimination scores are very, very important in order to know how well the person is hearing. It's not enough to know that the person can hear sound alone, but what sense he makes of the sounds which is translated into speech. And the last test is determination of the middle ear pressure. In the clinic, I get patients who get very reluctant because obviously you have to pay more for the three tests. If you just do a pure tone audiogram and say, okay, I'm done with it, that's it. But I tell them that it's important to pay this money so that you have thorough evaluation of your hearing. The middle ear test, like I tell them, just as you have blood pressure and you have pressure in your eye, you need to also have your ear pressure taken. Why? Sometimes if there is a cold behind the ear, that fluid will prevent you from hearing properly. Or if there's a problem behind the eardrum, which I cannot see in the clinic, that will reflect in the impedance audiogram. So this is known as impedance audiometry, which will tell you the pressure that is in your middle ear, which will then ultimately affect the way you hear. Of these three tests, only impedance audiometry is an objective test and which can be replicated in any other clinic that you go to. So the first is pure tone, which is mandatory. The second is speech reception threshold, speech discrimination score, and impedance audiometry. And for heaven's sake, go to a clinic which has a sound treated room and which has a competent audiologist to examine your hearing. So I think
very interesting, Dr. Christopher. I always imagine these tests to be related only to levels of sound, but you've opened our eyes to various other aspects today. In addition to just sound, even the phonetics can make a huge difference, telling you whether there is a problem as far as hearing is concerned. Very interesting. Doc, I have very often heard of pure tone hearing tests. That's something that's very, very common. Other than the pure tone hearing tests, are there any other hearing tests that are needed by any patient, young or old? Or is it simply the pure tone related stuff that one needs to be bothered about, the ones that you talked about?
Yes, that's, a really a relevant and valuable question these days that, people tend to just stop at this. But yes, there are two more tests. These computerized tests, and the importance of computerized audiometry is that very often when patients come to us pre-employment or they're trying to claim disability certificates, these tests are very important. Just as you have an ECG taken of your heart, there's a test that we call the ECG of the ear. It's known as brainstem audiometry. Okay, so this checks the passage of sound from the cochlea all the way up to the center in the brain for hearing. This is known as BERA, brainstem evoked response audiometry. This is totally objective. It does not require your cooperation at all. Especially in children who cannot tell you, newborns and things like that, who cannot tell you, I can hear or I can't hear. The first three tests that I spoke about were related to people who can say, yes, I can hear, or no, I can't hear. But what about children who can't hear, or adults who've got a stroke and they can't tell you if they can hear or can't hear? So this brainstem evoked response audiometry will tell you how well the person is hearing. In many situations, we use it to determine at what threshold the person can hear. They may not be able to speak back and say, yes, I can hear or not, but the organ responsible for hearing is intact. So brainstem evoked response audiometry is a valuable computerized tool. It is totally objective. The other test we have is otoacoustic emission. The beauty of these tests is that it is non-invasive. That means you don't have to insert a needle or poke the person. You just put on electrodes and you do the test. The OAE, the otoacoustic emissions, is used especially to determine the hearing of very small children. So this will tell you, can the person hear or not? Similarly, this can be done in adults as well who've suddenly gone deaf. We have a whole lot of people who have gone deaf very suddenly. So this will tell you, can the person really hear or not? This is very important documentation. So if the person wants to claim reimbursement or disability, these tests have to be done and are very, very important. And these tests are now offered at most modern clinics. So I think these are very important and valuable tests.
Absolutely agree with you, Dr. Chris. We've talked thus far about hearing tests, all right, a hearing test, proper hearing tests. But other than these proper hearing related tests, Doc, is there a need for any further evaluation of a patient overall, or is just restricted to these hearing related stuff?
Yes, this, if you focus only on the ear for hearing, and you miss out on everything else. So it's very important to evaluate the rest of the nose, throat, and neck. Oftentimes, I've seen a tumor in the nose which causes a problem in the ear. So it's very important to look at patients as a whole. I can give an example where I had an elderly musician who had two problems. He had a hearing problem and he had a heart problem. And he was always getting fluid in the ear. And we didn't know why. Then we got his thyroid test done and found his thyroid gland was just not working. So, and everybody said, he's very slow. So all these fitted in with a thyroid gland that is not working. So the minute we corrected that, lo and behold, the fluid in the ear resolved. His heart condition improved and suddenly became much more alert and very active. And everybody was astonished. And he told me, I'll never forget. He told me, he said, how I wish I'd come to you earlier and had my thyroid problem detected. Because everybody would just do a test and then a small operation would be done or some medicine given. But the fluid kept on filling. And he had a cardiac problem as well. So all these problems resolved once we gave him adequate thyroid medication. The other things that also influence hearing and general health are conditions like diabetes, and they may have a neurological problem like Parkinsonism. The reason why I bring these up, there are many other conditions, is diabetes is really a nasty illness. Where sugars go up, a person can lose their hearing. There are a whole lot of problems can occur. Their retinas can detach, they can get sudden hearing loss and things like that. So it's very important to do a blood test. Now, what happens is people they prick their finger and say, oh, my sugar is like this, like that. What we're looking at is the average level of their blood sugars, not just what it is only today. Of course, I'm interested in what is happening today, but I want to know on an average, how is your blood sugar faring? Very careful about your diet and so on and so forth. And Parkinsonism. Now, the reason why I bring Parkinsonism into this picture is that just now we're only talking about a hearing problem in seniors, but hearing problems are more often than not accompanied by other symptoms like giddiness and like a humming sound in the ear. Sometimes when we try to treat the giddiness, it worsens the Parkinsonism. And then, the patients tell me I had mild Parkinsonism, but after taking the medication for giddiness, my Parkinsonism has worsened. Or people may have subtle Parkinsonism, which gets worsened when you give medication for giddiness. So these factors need to be considered. Very often, at one time I was tempted to call myself otologist. That means only looking at the ear. But I realized that if I focus on only looking at the ear, I may miss out on all these other things. So, and I think it is important for any doctor not to just focus on his or her specialty, but to look at the patient as a whole. How does my diagnosis and treatment improve the life of this person without interfering with the other problems that are coexisting at that time?
This is just unbelievable, doctor. I mean, I can't just imagine that some other problem like a thyroid or things like that could actually have a correlation with your hearing problem. Absolutely an eye-opener. Tell me, Dr. Chris, seniors are generally considered to be very feeble, understandably so, and they are obviously very apprehensive about going in for a surgery and things like that, very reluctant to do that. Now, can a senior undergo a ear surgery? And do you think that senior, an aged person, would actually benefit from a surgery at that age?
I get asked this question very often. And when somebody is a senior, you have to understand that there are persons who are 70 years old who are absolutely fit and, they are good seniors. I've seen people who are 50 years old who are in bad health, and obviously they cannot undergo a surgical procedure. But yes, I would, if the person is in good health and the surgery, most surgeries like this are easy to do and are quick to perform. I'd like to show you two slides on this. One is if the person has a large hole in the eardrum and the person is otherwise in relatively good health and able to withstand the anesthesia, and a short, swift, simple ear surgery can do two things. One is that it will close the hole in the eardrum and improve hearing. The second thing is that very often seniors and most people who have a hole in the eardrum will be constantly discharging pus. So this forms a it is not accepted socially, especially if you're sitting next to somebody and the pus is stinking. The person who's suffering is embarrassed. So a short, simple surgery can close this hole in the eardrum. The other thing which I see now is that if the person has a disease called a cholesteatoma, which destroys the ear, this can be a life-threatening infection. So this problem certainly needs to be treated. Also, as time goes by, towards the end, I would like to share my experience with cochlear implants in seniors who have lost their hearing. But just now, I'll just show you two pictures, if I may, on a person
Sure.
who have a hole in the eardrum, and how a simple. Now, this is a simple hole in the eardrum, as you can see. This will improve. Now, this is to the left of your screen. I don't know. Can you see that, Sanju?
Yes. We can see this, Doc.
Yeah. So
very clear.
The small hole in the eardrum. To close this is a short half-an-hour surgery. So this, can be done under local anesthesia also. So if the senior cannot withstand general anesthesia, we can successfully close the hole in the eardrum. The one on your right side is a much larger perforation. This requires a lot more care and skill. But now this can also be done under local anesthesia. But a closure of these perforations lead to improvement in hearing and a cessation of purulent discharge. Now, this one I'd like to show is on the left of the screen. If you can see this clearly, this is a disease called a cholesteatoma. This destroys the ear. This infection can lead to a serious life-threatening infection. So this surgery has to be done. Now, again, if I have a 90-year-old person who's frail and in poor health, I would say, okay, a surgery is needed, but he's so frail that the surgery might do more harm than good by further compromising his health. In that case, I'll just keep the person under observation. But for this case, like this cholesteatoma, surgery is the only treatment of choice. So that's how surgical problems in seniors need to be handled.
Sure, Dr. Chris, thank you. I mean, that's been quite a comforting aspect for seniors. That really there isn't too much of a risk when a senior tries to go for a surgery. There's more benefit than any negatives attached to it. Dr. Christopher, over the years and over the months, there are so many different kinds of advertisements that we see, both on TV, we see it in the print media as well, advertisements about different kinds of hearing aids. Now, are these hearing aids really beneficial? What really do they do for us? What are these hearing aids all about?
Well, as the term suggests, hearing aid means it's there to aid your hearing or amplify your hearing. Now, there's been a revolution in hearing aids. We have analog hearing aids and we have digital hearing aids. In the old analog hearing aids, you just increase the volume of the sound coming to the person's ear. And so the person was able to hear. But you will hear all sorts of unwanted sounds. For example, you are standing on the street with an old hearing aid and the bus honked behind you. The sound was so loud that many patients or many persons wearing a hearing aid would feel absolutely ill because those harmful sounds were amplified. It has been reported that many patients actually fell down with giddiness and vomited because of being exposed to this noxious sound.
I see.
So it just increased the volume all across the board. Now, with digital hearing aids, we can amplify only selective frequencies. So the harmful frequencies, which are the very low sounds and the very high sounds, the amplification is a lot less. But the speech frequencies, so 500 hertz all the way going up to 4,000 hertz. Those are increased in the form of a gentle curve, so that one, the person hears clearly. Secondly, the person hears clearly without discomfort. But it must be remembered that, like I said, the caveat to this is the person should get a full-fledged ENT exam done by a competent person, number one. Number two, these 3 battery of tests need to be done. Number 3, anybody who has an infection or wax or something like that has to be removed. Then the hearing is fitted. We give a hearing aid trial. What is done by that? We put the hearing aid into the ear, we tune it, or we adjust the sounds to the patient's comfort. Then that person is allowed to go out onto the street. Some people give it, loan the patient the hearing aid for a couple of hours. Some give it for a week and say, try it out, see how much better you feel, and then get back to us, and then we'll then you tell us how better you were with this. There are a couple of things. Yeah, I can see you shake your head. Go ahead, Sanju.
No, go ahead, Doc.
The thing is that I tell people, when you get a hearing aid, first of all, you should be able to afford it. I call it the ABC. One, you should be able to afford it, because after all, this is digital technology and it is expensive. So it's not cheap. Now, I see a lot of people who get hearing aids that are dispensed from outside. These hearing aids are, a person will say, well, this is a 2,000 rupee hearing aid. They said it's cheap, I can't afford that other one. So they put that hearing aid, and then shortly after that, they are very unhappy because that has not been adjusted to suit their hearing, and so on and so forth. The second, the A is you must be able to afford it. B is that you must be honest with yourself and benefit from it. Like, I have a couple of patients who were sold a hearing aid and they felt uncomfortable and they did not benefit. So they told that doctor, listen, I can't benefit from it. So they were told, no, it'll grow on you. Over time, you will benefit from it. No, you have to feel the benefit immediately. If you feel that you benefit from it right here and now, then it will definitely suit you and help you. And the third thing, you should be comfortable. A lot of people wear the hearing aid and they're fidgeting, they take it out, put it back. That should not happen. You should be comfortable and say, why? Because when the person who's giving you dispensing the hearing aid should take a mold that fits the exact dimensions of your external canal, because the sound is going to be transmitted to your external canal to your eardrum. That mold should be snug. It should neither be loose nor should be too tight. If these two things are there, they cause a problem. So you should be comfortable. And I tell patients that if any of these 3 things is missing, for the love of God and of course for the love of money, do not buy that hearing aid. I also add caveats like, for example, that suppose the person has a hole in the eardrum and it has been dried, and the person is wearing a hearing aid. The hearing aid itself can cause irritation and can cause the ears to ooze pus. So, how to maintain that hearing aid? They should avoid wax going into the hearing aid. They should have the hearing aid tuned regularly. Number 3 is that, the hearing aid electronic device, you have to treat it with care, and you have to be very, very careful about it. And one more factor, I've noticed that when people go to an ophthalmologist and he tells them, well, I think your numbers increased, change your glasses, they do so very happily. But when the senior's hearing drops and the hearing aid has to be changed, they're very reluctant to do so. Partly, I think, because hearing aids are far more costly than spectacles, but people should understand that your hearing may drop and your hearing aid may need to be either changed or modified significantly to suit you. So these are the factors that go into a hearing aid.
Well, Dr. Christopher, you've been able to preempt my question. I was going to ask you what were the specific factors, and you've covered that so beautifully. Specific factors that one needs to consider when buying a hearing aid. I have a generic question.
You haven't preempted that question. Let me answer it in a different way.
Sure.
The hearing aid, there are two kinds of hearing aids. Body worn, which are what I just spoke about. And then we have surgically implanted hearing aids.
Okay.
So there are surgically implanted hearing aids. That's what I do. Body hearing aids are what the audiologists and the ENT surgeons dispense. We do not use the word selling, but we use the word dispense because these are medical devices and they have to be treated accordingly. Now, with surgically implanted hearing aids, towards the end of my talk, I'd like to speak a little bit about cochlear implants. There is a space where up to which a person will benefit from a hearing aid and beyond which he will not benefit from a hearing aid. And it's too early to be considered for a cochlear implant. So we have surgically implanted hearing aids. So those surgically implanted hearing aids are where I come in and then we decide. Now those are very tricky thing because we have to be aware that the person's hearing may deteriorate. One of the requirements for a surgically implanted hearing aid is that the hearing loss has to be stable. Now this is like trying to go to an astrologer and saying, will his hearing loss be stable? And you have to say, I don't know, because you cannot really predict. So this is a gray area where I come in. And believe me, it's one of the hardest and most difficult decisions of my life. So we have to consult the patient, explain to them clearly what is our track record. We have to be very truthful and honest about which person has benefited from it, which person has not, and what are the pros and what are the cons. And of course, they're also expensive. But the few that have been done have benefited significantly. However, their hearing at that point in time is stable. So we're all holding our breath and hoping that the hearing remains stable. If the hearing worsens, then we'll have to say, well, we have to think of something else to benefit.
Sure.
So those are surgically implanted devices vis-a-vis body-worn hearing aids.
Dr. Christopher, I have a more generic question for you. We have an audience today which consists of both seniors as well as youngsters, a mix of different kind of people. Are there any specific do's and don'ts that you would like to share with our audience this morning in terms of how one takes care of their ears? You know, people, how they could actually go ahead and ensure that they protect their hearing well in advance before they actually reach the stage of deafness. What kind of do's and don'ts would you prescribe to the general public or your viewers here this morning, Doc?
I sincerely hope and pray everybody takes this advice seriously that I'm about to offer, because I've seen the consequences of these problems. The most important one is avoid noise, avoid noise. I'll relate several instances from my real life practice. I had a young boy who used to wear a Walkman on his ear and go to sleep. He used to go to sleep at about 10 o'clock at night and get up at 7 in the morning. And the Walkman would play till it reached the end of side A and then play side B. When it reached the end of side B, it played to the end of side A and so on all throughout the night till the batteries were exhausted. When he saw me at the age of 14, he had unbelievably bad hearing. And, so his mother was saying, how come? Then I asked them, Walkman did not tell me, listen to the Walkman. Then I said, do you phone them? Then he related the story to me. And I was appalled because at a young age, he was so deaf and he was constantly, because he could not hear, I recommend putting him in front of the class. Even then he could not hear, that it fit him with a hearing aid. And once he ever had a hearing aid, his classmates used to tease him and so on and so forth. So exposure to noise, exposure to sound. Now I see a lot of people with wearing earphones, and believe me, it's the most is the worst thing you can do to yourself. Why? Ear canal works on the principle of a vibrating reed. It's 3.75 centimeters long. So when it vibrates, the eardrum also vibrates. Now, just a brief explanation. Sound travels best through solids, liquids, and then gases. Sound does not travel through a vacuum. So when sound enters your ear, it hits the eardrum. So it changes its medium. That means from air, it now enters a solid, the eardrum. Then the eardrum is 55 times the size of the round window. So that, because sound energy loses energy when it changes medium, the eardrum has to be 55 times larger than the round window. Then that round window transmits sound where it is converted into chemoelectric energy. So you can see it is a complicated, complex process. But in nature, the ear canal is 3.75 centimeters long. It is against gravity. And lastly, it is tortuous, that it is S-shaped. So God has designed it in such a way so that in nature, we are cut off from harmful frequencies. That is to say, if a person is living in a forest, he won't hear the sound of somebody honking on his motorcycle and things like that. Furthermore, we have something in front of the ear. I don't know if you can see it. It's called the tragus. You can touch it. I don't know. I like you all to touch it. See? It's called the tragus.
Okay.
But this acts as a high frequency bypass acoustic filter. The meaning of these words, high frequency, that means a very high frequencies. Bypass, that means it cuts it off from entering the ear. And filter means it prevents that from reaching the ear. Now, if you put earphones directly into your ear and you crank up the volume, you're bypassing that filter that God has given you. And you're pumping sound directly into your ear and will harm you. Now, these kind of hearing problems are seen in people who work in factories, who work alongside aircraft engines and so on. So they're exposed to noise. The tragedy of these problems of listening to sound all the time is that I liken it to, you go to the gym and you do 5 kilos every minute of the day. Initially, muscles will develop. Then gradually you start to get arthritis and things like that. So these people who are exposed to noise, they get a noise-induced hearing loss. It's a well-recognized entity. The problem with noise-induced hearing loss is that it is cumulative. Cumulative means little every day as your major megaton burden, which the ear cannot bear. And it is progressive. That is to say that every day your hearing will be worse. And worse still is that it is accompanied by symptoms of tinnitus or humming sound and persistent, consistent giddiness. So I urge all my listeners, all the people who will heed my advice, please avoid exposure to noise. That's the single most harmful thing on this planet. I also share with you that it has been found in the ocean. Supposed to be one of the noisiest things on Earth, places on Earth. Why? The propellers of all the ships and the submarines have all frightened marine life because, like I said, sound travels best through solids and liquids and then gases. For instance, the baby in the womb, that if the parents go for a film which is very violent, it's been shown that the baby kind of kicks and moves around in fear because of all the sounds that he's hearing coming from the screen, from the cinema screen, or even from the TV set. Or even the parents are fighting with each other, the fetus can hear that and responds in fear. The sound is that profound. Another example that I want to give you is caffeine. Please, caffeine can adversely and significantly affect your hearing and your health negatively. I had a young lady who came to me with profound hearing loss and persistent giddiness. She was in her 30s. So, we tried to look for the cause. And lo and behold, she says, I drink 12 cans of Red Bull every day, which has megaton of caffeine. So I said, why? So she said, my young son was very active and I have to keep up with him. So I stopped that Red Bull. Her hearing did not improve, but her hearing stabilized and her giddiness diminished significantly. So please remember, what you eat and drink affects you negatively. I'll share with you a small anecdote. We had a family friend who one day just very casually said, I get severe headaches and things like that. So then we were just talking casually. I said, okay, how long have you been having headaches? So she said, I've been having it since a very long time and this and that. Then we were at a party and she was drinking red wine. So I said, well, there's the cause of the headache. So she said, what? I said, yeah, wine has a lot of caffeine in it. So she thought I was joking. But I said, you stop drinking. And she used to drink red wine nearly every day. So I said, you stop drinking that red wine and see. And she said, they called me up after because said, you're absolutely right. I didn't realize that wine has caffeine and triggers of my headache. She had a migraine. The caffeine can adversely affect your hearing as well. The other thing that I'd like to really start a campaign, and that is, do not insert anything inside your ears. I cannot tell you how distressing it is for me to treat people who get problems because they've inserted objects in their ears. I got the Hamilton-Bayley Scholarship, as you have heard, because I cured 22 children who got tetanus because they were instrumenting their ears, and I managed to save their lives. You can get tetanus, you can get all sorts of problems. But the thing with inserting objects inside your ear is that, especially in diabetics, they get a life-threatening condition called skull-base osteomyelitis. I get referred on an average 25 to 30 patients a year who get this life-threatening problem. They're in hospital for a minimum of 2 months, and they're given antibiotics, which cost about 5,000 per injection. They have to take this twice a day for those 2 months. So you can imagine the extraordinary amount of pain, the extraordinary amount of discomfort, hospitalization, and the immense financial distress it causes. I had a lady who was in her 60s who had the skull base of America instrumenting her ear. And she was admitted for 2 months. And I remember with deep distress that her son was getting married, and because they had to pay so much, and that too even in a reasonably priced hospital, that he could not have his wedding, celebration. So they had to have just a limited number in a small restaurant, like in an Udupi restaurant, because they had paid so much for this treatment. So these two things, if you avoid instrumenting your ear, you'll save yourself a world of trouble. And if you have a problem, it's important to see a competent ENT surgeon who has equipment who will diagnose and treat. So this is what I would recommend. No noise, please, no earphones, no headphones. I hear these noise cancelling earphones, but I'm sitting next to the person. I can hear the entire song. That person cannot hear surrounding sound, but it's so loud that I can hear it. And it is very, very bad for the listener in the long term.
Dr. Christopher, a lot of my friends use phones, cell phones. Of course, everyone does that today. A lot of my colleagues also. Of late, I find that there is a tendency of people, rather than using the cell phone right at their ear, they would really use earphones, all right, because they believe that the radiation coming out of the cell phone would harm themselves. So therefore, stay away from the radiation and use a earphone. Now, can you guide us on whether this is a better route? Is our earphones a better route compared to just putting the cell phone at your ear and avoiding the radiation? Or guide us a few lines on this, please.
Yeah, this is a subject of immense debate. They say the jury is out, but I really don't think so. Now, this is a very relevant and pertinent question in the modern age that we're in. Every time you hold your cell phone and it turns on, the antenna emits ionizing radiation. Ionizing radiation, while it is used to treat cancer, can also cause cancer. So again, like I said, people who are exposed to cumulative doses. Now, more and more, we're seeing patients with strange brain tumors and strange tumors in general. People who sit next to one of these cell towers have been reported to have a lot of strange cancers. Now, if you remember the line when people were smoking, first they were showing the Marlboro fellow sitting on the horse and looking very macho. And over a period of time, if people of my generation will remember that they said smoking is injurious to health. And gradually the language evolved to smoking causes cancer. So it's taken almost 60 to 70 years for it to get to that stage because of the word of youth. It is directly associated with cancer. So I think something along those lines will happen. But cell phones are here to stay. So how do we use them? The best way to avoid either holding it too close or wearing earphones is put your speaker on speakerphone. Of course, if you are discussing something sensitive, then you may not want the other person to listen. And especially if you're say in a public space, you may not want to put it on speakerphone because it will be disturbing the people around you. Then the next best option is to put a earphone. The volume should be turned down till you are just audible and use it for the minimum possible time. So this is what I would advise. The best, of course, is speakerphone. Speak for the minimum possible time. And if at all you have to wear an earphone, the volume should be turned down till the speaker is just audible and you are able to hear what is being said, and use it for the shortest period of time.
Very often, Dr. Christopher, we feel the need to clean our ears. Very natural thing. You feel a little itchy and you feel probably I should use a cotton bud and have our ears cleaned. Is this harmful, cotton buds, cotton earbuds that we often use? What are your thoughts on that, Doctor?
On an average in the clinics, I say about between 20 to 30 patients. And half of those have problems related to cotton buds. Half of those.
Wow.
Now, this is, and I use the word problems. Let me tell you, once upon a time, they were known as cotton earbuds. And the company that made the buds was sued. This is $1 billion, B for billion. Okay, they were sued for billions. But this is $1 million industry. So they just removed the word earbuds and just call them cotton buds. Now, of course, I've given away the thing, but I'm going to tell you. So I've had any number of patients. Doctor, every morning I use these buds and I clean my ears for the last 20 years. I said, well, God himself has been looking after you very well. So they said, why? And because he prevented you so far from getting a problem. But on the other hand, they don't see the patients whom I get who have had problems, including those 22 patients who have had life-threatening problems. So I pose them a trick question. I show them this box like this and say, are they cotton buds, cotton earbuds, or are they earbuds? Are they cotton earbuds or are they earbuds? You have to swear on 100 rupees stamp paper. Are they cotton earbuds or are they earbuds? So I said, I'm giving you exactly 10 seconds because you say you've been using them for the last 20 years. Believe it or not, in all these years, only one person has told me the right answer. Now, actually, this is a trick question because I say, are they cotton earbuds or are they cotton buds? Or are they earbuds? I don't give them the option of saying, are they cotton buds? So then I show them this thing that just says buds, cotton buds. So then they recall and surprise, say, goodness me, I really didn't know that. I said, then use one more thing that you will not know. There's a warning at the back which says, do not insert in ear canal. So if you try to sue them after this magnificent lecture that I've given, you can't win because they said, you're the dummy. There have been earbuds, and we've written a warning at the back. Of course, the font is like maybe 10. So you really have to use a magnifying glass to see that warning. So that's how people get misled. Now, why are these buds harmful? There are 5 reasons. I have, if I may, I have a model of the ear. Can you see that? I don't know. Can you see that?
Yes, yes, very visible to us, doctor.
Okay. So now, out over here is the eardrum. This is the ear. From here to here is the outer part of the ear. Okay. This is the middle part of the ear. Now,
Sure.
the reasons are, one, you don't know where your eardrum is. So you may land up puncturing the eardrum, or you may push all the wax back onto the eardrum. Number 1. Number 2 is that you can introduce infection. And this infection, like I said, can be tetanus, can be fungus, can be this and that. Number 3, the cotton can fall off the applicator. And this can, reside there, forgotten, until at such time that it gives you a problem. Number 4 is that, you can injure the skin of the ear because it is tissue paper thin. When we are operating on the ear, you have to make sure that we don't tear the skin of the ear canal. Number 5 is that, as you can see from this model, the brain rests on the ear bone. So there, as you can see, this is the external canal here. The thin shelf of bone separating the brain from the external canal. Now,
Okay.
If you accidentally injure one of those blood vessels, you can send an infection shooting straight into the brain. And I'll show you one more thing. Now you can see, I don't know if it's really that this is the bony part, this is the cartilage part. So there's a gap between the two. And through this gap, infection, is it clearly seen out here?
Yes, yes.
Okay. So infection can track in between the bony part and the cartilaginous part, and then enter the soft tissues that surround the ear and the brain, and result in a very nasty and bad infection. This is known as skull-base osteomyelitis, which I've told you. Patients spend a lot of money getting this treated, and then they, they're near death. It's a serious life-threatening infection. Now, patients ask me then, doctor, how do I clean my ears? So my answer to that again is that this is the only cul-de-sac in the human body lined by skin. So skin, the wax is manufactured from the center of the eardrum. And that is gradually extruded out of the ear in a conveyor belt-like mechanism. Also, when you chew, that propels the wax out of the ear. So you don't need to clean the ears yourself. The ear has a self-cleaning mechanism. If forever, for one reason or the other, you feel that there's a buildup of wax, please go and see your ENT consultant. So this is the advice that I give regarding cotton earbuds.
It's amazing how God has made each of us with such distinct benefits, that can automatically take care of itself, doctor. Really very interesting. Dr. Christopher, you've been talking for the last 1 hour, but I cannot but help to ask you one last question before we take questions from the audience. There's so much that one has heard these days about cochlear implants, all right? And often it is described as a miracle of modern day medicine. Can you throw some light on what exactly this implant does? Does it completely restore hearing in a senior, or for that matter, in anyone else? Talk us a little bit about it, Doc.
Yes, this is something that has been gaining more and more momentum and more prominence. Unfortunately, when the first cochlear implant was performed in India, it was a single electrode and a primitive device. But that was a step in the right direction. So that's how cochlear implants got introduced to India. And as time, this was in 1987, as time has progressed, the device has become far more sophisticated and far more evolved. And we understand, most importantly, how to select the patients who will benefit from such a device. The device is used for very young children who are born deaf. You have to do them by the age of 2. in order for them to acquire speech and language. But that's a different subject. I'm talking about seniors. Now, a senior who suddenly goes deaf, he has already heard and learned and acquired speech and language. So the cochlear implant stimulates the hearing nerve directly, and almost immediately patients begin to hear.
Wow.
The persons who benefit from this, I will share with you 2 or maybe 3 stories where, you know, it made such a significant difference that these patients have got their life back. Now, I only say, get your hearing back, get your life back. I've also authored one of the biggest books in the world on this. With your kind permission, I'll just, you know, like to share this with you. And this is a book that I've done. This one. It's called Implantable Hearing Devices. This I published in the US. It's listed under my name. And it's you can go onto the net, and it's freely available. The thing is that seniors benefit tremendously from this device. And all over the world now, apart from focusing on deaf children, people are focusing on seniors who have gone deaf. Because like I said, after a while, the person will not benefit from a hearing aid. Then he reaches that gray zone where the person will benefit from an implantable hearing aid. But sometimes they worsen so much that they are so deaf that they'll benefit neither from a hearing aid nor from an implantable hearing aid. So in that case, we put in a cochlear implant. Now, what are the things that a person gets from this? First is clarity of sound. That means the person could not hear. Now the person can hear all over again. There's a difference. When you hear like this with sound coming in, naturally, that is acoustic hearing. But when the device is put into the cochlea, they have electrical hearing, because an electric current stimulates all the frequencies of the cochlea. But it gives them clarity of sound. The other important thing is that it gives them directionality. I will share with you 2 stories. I had an 80-year-old gentleman who had gone deaf, unfortunately, in both ears at the same time. So we got him extensively investigated because we said this is maybe a stroke and things like that. But finally, just turned out that for some bad reason, he lost his hearing in both ears. Now, we told him about a cochlear implant. Now, he was very reluctant because he was living all alone by himself. And so then I said, how do you answer your door? And believe me, he was driving a Maruti 800. I would tell him, for God's sake, don't drive it because you won't hear and you knock somebody down. And he was
absolutely.
So he used to put on so anybody who rings his doorbell, the light will go on. To cut a long story short, his son took him to the US, had a cochlear implant done both ears, and he's hearing so well, and you can't believe it. I had another senior who had gone deaf in 1 year, refused to have anything done about it. He went out of the country, lost his hearing in the other year. He called me up, but he was in a foreign country. That doctor could not understand. So I texted him the medicine. The doctor gave him the medicine, got his hearing back, came and said, I want a cochlear implant. So we implanted the ear which had gone deaf initially. He got his hearing back in the other ear. Lots of time had passed, and gradually he's starting to lose his hearing again in the ear that was good. Now the cochlear implant has provided him hearing benefits which initially he thought he didn't get. His wife told me that he can now hear clearly and that he has good directionality. So implants are definitely, they're not objects of the future, they are of the present, and as they evolve, they're going to get better and better.
Dr. Christopher, what do I say? This was absolutely an incredibly useful and interesting, knowledgeable session. Thank you so very much. Thank you so very much. I'm very sure hundreds of people all across, not just on this live show, but even after the show, will benefit from this very, very useful session. We will now take a very short break for an announcement, Dr. Christopher, and then we'll get back again to questions from the audience. But before I get on to the special announcement that I have, I'd like to remind all our listeners, If any of you have any questions, you can go ahead and post those on the chat. I think I have already received about 10 questions. All right, so we have enough on hand. I'm afraid we may not be able to take too many. May I request Aubrey and Ian to stop taking any further questions? I think, we've had enough at the moment. But let me get on with the announcement before we come back to the audience questions. Ladies and gentlemen, our fifth virtual live talk show under the Knowledge Worth Having series will be held on Sunday, the 19th of September, 2021 at our normal 11 a.m. Indian Standard Time, only on the Catholic Gymkhana YouTube channel. The speaker for this talk show will be the very veteran advertising and PR professional, Mr. Roger Pereira. For those of you who may not know Roger Pereira, Roger is acknowledged, awarded, and rewarded across the globe and wears many hats at the same time. The title of this live talk show will be Take Charge, My Friends. Take Charge, My Friends. The session is expected to cover various aspects of entrepreneurship, mentorship, civil services, and the armed forces. Now, this is going to be a very interesting session. Having been an advertising and PR professional himself, if Roger were to relive his life all over again, I wonder what he would opt for as a career. Would it be a flamboyant advertising career, or an articulate PR professional, or a flashy theater personality? We suggest that you invite all high school and college students, along with the parents, to attend this show and be guided by a possible career opportunity from the man himself. So be there on Sunday, 19th September 2021 at 11 a.m. sharp Indian Standard Time, only on the Catholic Gymkhana YouTube channel. Ladies and gentlemen, we will now move over to the questions that have been received from our audience. Doctor, as I said before, we already have 10 questions. I think there are some more coming in as well. All right, and as I said earlier, could we stop taking more questions, Aubrey and Ian? We'll get on with the very first question. Here it goes. What should be done for a senior who suddenly loses his or her hearing?
That person should be...
just a moment, Doctor. Just a moment. I have an extension to this question. And are there any invasive operations or gadgets available to repair the deafness? Question one. Go ahead, Doctor.
Yes, the person should be investigated because this is considered to be an emergency. For these kind of situations, we give the person steroids it's a well-documented medication to revive and restore hearing. The important thing is that the person should report immediately and get ready to have this treatment given. Now, persons who have got diabetes, we cannot give them steroids because their blood sugar levels will go up. So instead, we inject steroids inside the middle ear, and there have been very good success rates. This is an emergency, and person should not take this, as a trivial incident. There is a medical emergency. Why? Because the same thing could happen to the other ear, and then the person will be in dire difficulties. So the person should get immediately, should get treated. We give them steroids and antiviral medication. So yes, we have 4 options. The first is we tell them do nothing if the person doesn't want to spend or do anything. If after efforts to revive their hearing, they don't get better. The second, we give them a cross hearing aid. Cross hearing aid stands for CROS, contralateral routing of signal. That means we put the microphone in the ear that's gone deaf, the wire, we transmit the sound to the good hearing ear. So this the person can, otherwise the person will not be able to tell from where the sound is coming. The third option is bone anchored hearing aid, which is a surgically implanted device, which is something that I do. Again, it does not revive the cochlea, but transmits the sound to the other ear. And the fourth option, which in many ways is actually the best option, is we give the patient a cochlear implant. We do this so that in case the person goes deaf in the other ear, at least one cochlea is ready for hearing. It's proven to be very good and have good results.
Second question, doctor. I think you would have partly covered this earlier. What should be done for a person who is deaf in 1 year only?
Well, like I said, we give them a cross hearing aid, we do a bone anchored hearing aid, or we give them a cochlear implant. And depending on the duration of deafness, if the person has gone deaf just recently, I would like to insert a cochlear implant because the nerve cells can still be revived. If the patient has been deaf for a very, very long period of time, then I would opt for a bone anchored hearing aid.
Can surgery repair a perforated eardrum? And can this be done on a person who's in his 70s?
The answer is yes. However, it will depend on the person's medical general health. If the person has got good general health and is free from an infection of the ear, a short, sweet, simple surgery will repair the eardrum, the person will hear better, and the chance of pus coming from that ear will be negated.
Sure. Question number 4, doctor. For how many hours in a day can one wear a hearing aid, and what is the downside of using a hearing aid?
A person can wear the hearing aid as long as they want, but remember the battery, it is a battery-driven device. So I would tell the person that wear it even when you're at home. People say, no, I'll wear it only when I go out. The answer is wear it at home so you can converse with everybody else, you can hear what's being said. And the downside of wearing a hearing aid, one is that you have to take care of it, don't drop it down. Sometimes the hearing aid can cause an external ear infection and the hearing can get blocked. Most importantly, remember that it is driven by batteries, and those batteries will be need to be changed frequently. Something can be
okay. Sure. Why should a person have a perforation repaired before wearing a hearing aid? And can a hearing aid be inserted without repairing the perforation on the eardrum?
Yes, a person can wear a hearing aid even though he has a hole in the eardrum. But the problem with that is repairing the eardrum will increase the benefit of hearing from the hearing aid. Secondly, the hearing aid itself can cause pus, or if the person gets an infection, the pus can go in and damage the hearing aid. So for this reason, I tell people that better to have the perforation repaired. However, if the person still declines, then say, all right, go ahead, wear the device, but make sure that when you have an infection, do not wear the device, because otherwise it will degrade the device.
Sure. Doctor, question number 6. If you have a tooth decay, very interesting. If you have a tooth decay or a gum problem, does this also affect your hearing?
Well, if you have tooth decay, you'll be in so much of pain that your probably sound will be very irritating. So I would recommend that a person have their tooth decay and gum problems resolved simultaneously. But no, it will not affect. They should wear the hearing aid and simultaneously get this health problem treated.
Okay, we move on to question number 7, doctor. Are there any treatments or modalities or hearing devices for seniors who are completely deaf and who do not benefit from hearing aids at all? Those who are completely deaf, is there any solution for them?
Yes, as I mentioned, cochlear implants are the devices of choice, and they provided the patient with significant benefits. Now, we as a nation, we have 25 million deaf children as we speak, and the number of deaf seniors are much, much more. Now, the problem is that because they are seniors, they're not earning members, so they're neglected. But once they're implanted with a cochlear implant, their contribution to the family, like looking after the grandchildren, responding to whatever domestic chores, has proven to be exponential. So now, a lot of us in India and all over the world looking at deaf children, because obviously their future is linked to the future of the progress of the country. But we found that treating deaf seniors or deaf adults with cochlear implants has proven to be equally significant, has not only contributed to the GDP of the country in terms of productivity, but also to their protection and their conduct at home and in their surroundings. They're no longer neglected. They can contribute to household chores in a very meaningful way. So treatment of hearing problem senior really requires a lot of importance and should be.
Sure. Question number 8 coming up, Doctor, and I think you partly touched upon this earlier in your session. Does hearing loss have any connection with early Parkinson's or dementia or any other ailments at all?
It certainly does. What happens is that the ear mimics the kidney in many ways, and sometimes the end vessels of the heart. So whatever happens in the ear, especially if they have a nerve hearing loss, sometimes reflects on the functioning of vessels of the heart and of the kidney. So these, it is not a one-dimensional problem, it's a multi-dimensional problem. Also, certain studies have shown that if patients lose their hearing in one ear, it can lead to bad neurological health, and they can even get a stroke and things like that. So this problem needs to be addressed. We have to look at the patient as a whole, examine all the systems to make sure that none of them are affected.
Okay, question number 9 coming up, Dr. Chris. Are there any age limits for persons needing hearing aids? And can hearing aids reverse dementia? I'm not very sure whether they need to know whether hearing aids will reverse dementia or hearing aids would reverse the deafness as well. You could address both, Doc. Are there any age limits? And could the hearing aid reverse? Yes.
Hearing aid won't reverse deafness, but it will certainly, make the help the person hear better. And again, I draw a distinction between hearing aids, which are body worn, vis-a-vis cochlear implants, which are also known as hearing devices, but those are surgically implanted devices. So having a surgically implanted will certainly restore hearing, but a hearing aid will just amplify sound so that the person can now hear it. About it reversing dementia, certainly there has been a direct link between deafness and Alzheimer's. As I said right at the beginning of the talk, the person who cannot hear will respond incorrectly. That will lead to him being isolated by society, saying, don't talk to this guy, he's talking nonsense. That isolation is hurtful and can lead to depression. Prolonged depression can lead to Alzheimer's. And if the person is in early Alzheimer's and you identify it and you identify other factors like nutritional and you give a hearing aid, it's found to improve cognition significantly, and Alzheimer's is then, not worsened. But if these are ignored, then the person will develop full-fledged Alzheimer's disease.
Okay, moving on to question number 10, Doc. We have 14 questions totally, and I think we've stopped taking any further questions. All right, we move on to question number 10. For how long should medication be taken for stabilizing hearing? For how long should medication be taken to stabilize your hearing?
Indefinitely. First of all, I have a prescription. I can show that. But we have very little medication to stabilize hearing. Of them, I give people a tablet called Nicergoline. And I think there's only one company in the market that makes it. It's called Cochlear. I give it at night. And I give them a set of vitamins and certain do's and don'ts. Don't instrument your ear and things like that. And I have found that over a period of time that it has stabilized hearing. Now, what do I mean by that? I tell people to go right to the top of a slope in a steamroller and you're going down the slope. If you don't put on brakes, then you're going to crash onto the rocks below. But if you go down slowly and carefully, then you can reach the edge of the road without harming yourself. By that I mean that analogy, I mean that I'm here to help you let your hearing last you your lifetime. So these certain prescriptions, like I said, Cochlear, which I give once at night, I give Neurobion, I give vitamin E, and a few other substances, get your diabetes under control and things like that. Those have helped people significantly. I've been in practice 35 years. I've had many people who've come to me and say, renew my prescription. So my question to them is, has it improved your hearing? Some of them say yes, but most of them say my hearing has remained the same. In addition, what I look at is also other core symptoms like humming sound in the ear, giddiness. Those have all abated. So the ear in general is stabilized, the hearing has stabilized, the symptoms of giddiness and humming sound in the ear have reduced significantly. Therefore, I prescribe these medications, and these have really helped people to stabilize their hearing. About lifetime, I don't know, like I said, but I've witnessed several people who've come in for renewal of prescription over 10 years. So I know that there's definitely benefited them.
Question number 11, Dr. Chris. Can inserting oil in the ear or use of Waxol be appropriate, or is it harmful? And likewise, some people have advised and prescribed the use of oxygen peroxide to remove wax. Is this advisable?
Oil is absolutely out of the question, because if you have a small hole in the eardrum, the oil can trickle back into the middle and then into the inner deafness. About Waxol, I think that needs to be prescribed, because I see a lot of people who take Waxol, it won't harm you, but they don't have any wax at all. So when they put it there, they say my ear is blocked. It's naturally because the Waxol has coated the eardrum and therefore given you a conductive deafness. So I remove the Waxol. Now I tell people that first see a physician before you do that, and then only use it judiciously. Don't use it forever. People are under the impression that they have to get rid of the wax. They don't know that they already have a conveyor belt-like mechanism in the ear, which causes the wax to extrude. And sorry, what is the last part of the question? About hydrogen peroxide.
Right.
I don't advise hydrogen peroxide. And the only reason is that there's a release of heat. And that heat can cause people to feel severely giddy. I've seen many people use hydrogen peroxide, got dizzy and been vomiting and things like that. So I would Solivax or Waxol, yes. Hydrogen peroxide, no. And use of oil, absolutely out of the question.
Okay, moving on to question number 12, Doctor. Can you suggest a nerve tonic to prevent further hearing loss, and for how long should it be taken? And there is an extension to that question as well. Are Cognix Plus and Rebagin nerve tonics? Are both these nerve tonics?
Well, like I said, see, there are a lot of things in the market that are touted as nerve tonics. My use of, I've used this Colabor nizocoline extensively, and people, like I said, have benefited. Now, I have not used Cognix, but I've seen a lot of people who use Cognix. These are basically combinations of ginkgo biloba and things like that. So I would say, well, it can be used, but I have no experience with Cognix. But Rebagin is not a nerve tonic at all. So I would advise that people use vitamin B12. Vitamin B12 is responsible for nerve conduction. And this in many ways has also been implicated in Alzheimer's. So I would tell people, get your vitamin B12 levels estimated, and then start treatment. Now, people who drink alcohol need to have vitamin B12 regularly, because that gets extruded when you drink alcohol. I have many people say, well, my vitamin B12 is 900, so I don't need to take vitamin B12. So my answer to that is, yes, at the moment, your vitamin B12 levels are 900, so you don't need to take vitamin B12. But I recommend that you take vitamin B12 at least once a day, because it is one vitamin that is essential. People should remember also that when you take vitamin B12, B6, B1 all together, there's only selective absorption. So only one of the vitamins will be absorbed, not all at the same time. Second thing is that vitamin C will prevent absorption of vitamin B12. It's called, it steals vitamin B12. So, but vitamin C is also necessary. So I tell people, okay, you take your vitamin C at night when you're not going to take any other medication, or you take it at a time when you can take it alone without taking any other medication. So there should be a 5-hour gap. Then after that 5-hour gap, you can take the vitamin B12. Then again, wait for some time, and then maybe you can take the other vitamin, whatever you want. But vitamin B12 is certainly important. I give people this nitroglycerin. I think a lot of people are starting to catch on with this Colorgol, which is a very important ingredient in my prescription. And I found that it has stood me in good stead. I really have no cognics, though I've heard a lot of people say that they're using it like a nerve tonic. And one or two I've spoken say, well, yeah, I think it works, but they also don't seem to be sure. But like I said, I'm pretty sure about Colorgol because I have many patients who come in for renewal of their prescriptions.
The second last question, Dr. Christopher. If one has giddy spells and loss of hearing and a sense of balance or imbalance, what could be the reason? And is vertigo or giddiness related to hearing problems? And an extension to that, what are the solutions to these problems?
Well, now we're talking about, whenever you talk about vertigo, humming sound in the ear, and hearing loss, we're talking about a condition called Meniere's disease. This is a disease specifically located in the inner ear. Now, this is a very complicated problem, and our understanding has changed over the years. Initially, people would do a surgery to relieve patients of giddiness, and many solutions have been recommended. You cut this nerve and do this and do that. All of them don't work. Why? Because the fundamental understanding of Meniere's disease, even as we speak, is not yet known. I myself am in the process of authoring a book on the subject. So a lot of people say it's psychogenic, but the person came to me like this, I would say, number one, zero caffeine. Zero caffeine. And that means no chocolates, no coffee, no soft drinks which are packaged, and no alcohol.
Wow. And no alcohol as well?
No alcohol at all. And
wow.
Your cheese intake, because there's tryptophan in it. So these 5 things, zero caffeine, and I'm very insistent on that. And I say low salt. I can't say no salt because salt is essential, but low salt diet. Then, if you have a problem like hypothyroidism, that means the thyroid gland not working, have it corrected immediately, like I explained about that musician who had these problems. Try to identify common problems like thyroid gland not functioning, diabetes, and things like that. And you'll understand that this is an important problem that is playing a role in your giddiness and hearing problem. It is indeed a very, very tragic problem for the sufferer, because only that person can say, well, I'm suffering. Other people are saying, why are you acting? Why are you playing around? But they don't know that the person is really suffering. A very important ingredient in the cause of these problems is caffeine. There were some reports in literature on monosodium glutamate, which is all Chinese food and things like that. So that has also been found to play a role. People go and have a Chinese dinner and come back after having a lot of monosodium glutamate, and then they feel dizzy. So yes, that's also implicated in that. So zero caffeine, avoid MSG, low salt, and treat other problems like diabetes and the like.
Well, moving on to our very last question for this morning, Dr. Chris. Does hearing loss lead to depression and loss of confidence in movement?
Yes, the short answer is yes. The long answer, I don't know how many. Like I said, it leads to isolation. You've been deprived of one of your senses, and people will consider you an outcast. The depression worsens, and then it leads to isolation because it's called the head shadow effect. For example, if a person has gone deaf on this side and can hear from the other side, a person speaking from this side will not be heard. So there's the head shadow effect. Whereas a person speaking from the good side will hear. So a person speaking from this side will say, why is this person ignoring me? When he can hear the other person. So this can lead to a problem where what we call the head shadow effect. The other thing is that the person who's lost hearing in one ear loses the sense of direction. They're not able to tell the sound from where the sound is coming. And like I said, they'll mistake P and B, M and N, miss sibilant sounds. When they go to a crowded room, they'll get lost. So these problems need to be addressed in a very, very authoritative manner, and the person should feel better at the end of it.
Wow, Dr. Christopher, this was truly, truly an incredible session, I must admit. Absolutely incredible. Ladies and gentlemen, it is now time for a praiseworthy vote of thanks. When it comes to a vote of thanks these days, there is just one name that is becoming synonymous with our vote of thanks. He speaks from his heart and it comes across genuinely. Ladies and gentlemen, I'm referring to none other than our own managing committee member, Mr. Ian Pereira. For those of you who may not be aware, Ian is a Catholic Gymkhana managing committee member and also a part of the technical team bringing the show live to you every month along with Aubrey. Being a professional photographer by profession, Ian has an eye of an eagle, I can tell you that. No wonder, absolutely no wonder, our posters and promotional materials stand out so well. Being the secretary of the PR committee, Ian, along with our very popular chairperson of the Public Relation Committee, Yvette Malgi, helps Catholic Gymkhana maintain our connect with members and their guests. Ladies and gentlemen, I call upon Mr. Ian Pereira to propose a vote of thanks this morning. Over to you, Ian.
Thank you, Sanju. I mean, you said the right word, incredible talk. It was really incredible and so simple and well explained that, with all the model and the slides. And I personally didn't know so much about the ear and how fragile it can be, or it is rather. I know some people who are conveniently deaf. I've seen, wife shouting instructions from the kitchen and they pretend they can't hear. So I'm sure doctor must have caught a few like that. And but it was a brilliant talk, and I'm wondering whether I should use the earphones anymore. So I think next time there's no one at home, I can do the Zoom meeting without a earphone, with headphones. Anyway, doctor, it was a brilliant talk, and thank you very much for this spending Sunday morning with us, and also the preparations that went into it before. And coming to Sanju now, I mean, you can see this getting better and better each time. But being a finance man and also into training, he's so meticulous about everything he does, being the treasurer of the Catholic Gymkhana too, and also his hobby come profession of comparing and moderating events. And he makes it look so easy, but believe me, lots of work has gone in the last month to get this talk, so good. We also have a tech man, Aubrey, sitting in Pune, and he's been collecting all the questions, clubbing the common questions together, and then passing it on to Sanju's control room. That's Nirmala, his wife, and his daughter Chrisel. Thanks to them too for their cooperation and getting, this makes it so easy for Sanju to just concentrate on the question and answers. And then, of course, we've had a lot of viewers. I think we touched 190 today, and that's thanks to the communications department and everyone else for sharing this link and worldwide, to get a worldwide audience. And thanks to Doctor once again for this wonderful talk. Very enlightening, and I think I'll need to come to you soon because my wife says that the TV is too loud when I'm watching TV, so I think I'll have to consult you soon. Anyway, thanks a lot, and back to Sanju.
Thank you very much, Ian. Ladies and gentlemen, did I not say that Ian speaks from his heart? The good part about Ian is that the genuineness of his thanks are manifest in his words. You do a great job, Ian. Thank you so much. Dr. Christopher, before we go, I have one last question for you. Can I? With your permission, please. Sure. All right. Pardon me for this, but most married men seem to have a selective hearing problem. Do you have any treatment for such kind of married men?
One is they have selective hearing problems, so I encourage them. That's how they're able to remain married.
Absolutely.
The second thing is that I can tell how long they've been married. If they've got 50% deafness, I say, okay, you've been married 50 years. You got 10% deafness, you've been married 10 years. That's how we're able to tell them how long they've been married. As far as that's concerned, I just say, stay deaf, but stay happy.
Thank you. Brilliant advice, doctor. I can now count by the years I'm married of how deaf I am. Ladies and gentlemen, I'd like to remind you that we will be seeing you again on the 19th of September 2021 at 11 a.m. sharp for the 4th talk show. I also need to remind you that every Saturday at 9 p.m., we have the Members Night, which is a live band performing from across the country. We have great numbers, great viewers, some amazingly good performers that come up every week. The live band, or the Members Night as we call it, is so very popular. It keeps getting better and better. It's now more than 50 weeks on a trot, more than a year that we have been doing this week after week after week. But before we end, ladies and gentlemen, I'd like to leave you with a thought this morning. We are blessed with one tongue and 2 ears so that we listen more and talk less. In order to listen, we need to hear well. So visit Dr. Christopher De Souza and get your hearing back. But on a lighter mode or a lighter note, here is something that all you married men must hear very carefully. A successful marriage, they say, is one where the husband is deaf and the wife is dumb. With that, ladies and gentlemen, this is your friend and compere, Sanju Fernandez, signing off. Thank you, goodbye, good afternoon, and stay safe.